Togoso asensemo yobochenu asomo bisomo nena se izara yobochenu Miri Muthoni haesokire na kurukuburia guchiase abasubati na abana banyaruka koneke buna ngwesokia bari genkio na gukorwa okorengwa ande mono asamaroire buna bori bwa cancer kero mutinyi bwoko ubeka oko bosoko inyoria igoro yoburoire bwa cervical cancer Muthoni ni gatebire oboriro obwo boise konyara koba bokorengwa chinga kichiage nkio nigo burache koba bokurwariwa akwenekia abana nchi nkobwena bare asaburia abana nchi abange baisokie na kwerikia nse yomurubirio bwoko bwatu koba konyo bubwene kurwa serikali osha.
Cervical cancer is affecting many women in different ways, and one of it being the social and economic concern, because when it affects women in their most productive years, then the productivity, whether it is in regards to children or economy, it goes down. And again, many patients are mothers and caregivers. Many patients are women who have children who are going to school. Many patients are women who are at their early age of production. They have husbands. Therefore, it really impacts on families and the livelihoods of ourselves. Kenya is very committed to the global goal of eliminating cervical cancer as a public health problem. And as I have highlighted before, 90% of HPV vaccination to our young girls who are below 14 years, screening, voluntary screening for our women between the ages of 25 and 49 years. And that takes 70% of that. If we are able to screen them, no woman should die. No woman should die out of a preventable disease. No woman should die when we can vaccinate the girls early. No woman should die when the disease is treatable. It can be prevented, it can be detected early, and it can be treated. At the moment, SHA has a package of 800,000 for treatment of cancer, and that should be a motivation that if you are sick, then you must be treated. HPV vaccination protects girls early, and HPV vaccine prevents cervical cancer and is very safe and effective. There has been a lot of talk here and there and a lot of hullabaloo around it. But I want to confirm to the members of public that HPV vaccination is very, very safe. As long as it is coming from the Ministry of Health, then that is a safe vaccination.